here just going through a quick glucometer training. This is the glucometers we'll be using. They're going to be stored inside the AEDs as of right now. As of right now, we are using the McKesson. That may change at some time, but they're all the same basic components from the glucometer. A couple quick steps for the glucometer that you will need to learn. Very simple and easy process. You just have to get more comfortable with it if you have never used a glucometer in the past. The glucometers are typically used for patients that have any kind of altered mental status or suspicion of a patient having a low or very high sugar level. Otherwise, there's no reason to use a glucometer. You need to use this for every patient. But under a suspicion or a patient that's AMS, it should be used. There are a couple components from the glucometer, a couple things that you should learn. So the first one is the glucometer. Second one are the test strips that are inside. You will have the test if there's ever a question whether there is any, if the glucometer is not reading correctly, you can also test it as well with this test fluid over here. You're going to have the pieces that actually make the puncture, known as the lancet, and then you'll have the alcohol strips. So alcohol, lancet, test strips, the glucometer or the glucometer, as well as the test solution or the control solution. So first thing you need to do is you should get the glucometer ready as well as the test strip. The test strips come in this canister. You should make sure that they remain as clean as possible, and take one out and make sure that you close it off immediately. Next thing you want to do is as soon as you push it into the glucometer, it's going to turn on. I don't want you to turn it on immediately, so don't push it in all the way. You'll need to do that in a few moments. So I usually just set it up first just by putting it in there, and then when I'm actually ready to administer the test, I'll push it in all the way. Put that on the side for the moment, and then I'm going to take out my next two pieces of equipment. The next pieces that I'm going to need are the alcohol swab. If they come in the set, rip them in half, and so you just have the one piece. And you're going to have the lancet. The lancet has a device on here to protect itself, that blue piece. Some of them you need to push in and pull out. This one, a little twist action and pull straight out, if that should work. Twist and pull out. If it's a little difficult to do so, pull hard. All right. Next thing I want to do is I want to be able to find a good blood vessel on the patient. Now, the bigger the finger, typically the more blood vessels. That's why I tend to like the middle finger, which happens to have more blood vessels, as it is a bigger finger and typically has a little bit more muscle mass on it. So I tend to like using the middle finger. Now, if you're using the pad, is not where the blood vessels are. The blood vessels are usually on the sides. So you don't want to stick the glucometer, the lancet directly in the middle. You want it more on the side. All right. So I'm going to open up that alcohol swab, and I'm going to swab the side and a little bit of the surrounding area. If it's dirty, make sure you get all the dirt off. You don't want to have the patient exposed to any dirt that's on there. And make sure it's nice and wet. Now, after it's wet, I need to make sure it's dried, as that is the component that allows for the dehydration process, which kills any bacteria that's on the skin, as well as any kind of wet alcohol will interfere with the test. So make sure that it is completely dry. Next thing I'm going to do is take that lancet, place it nice and firmly up against, so nice and firmly up against it, and just push a little button, warn the patient this is going to sting a little bit. All right, 1, 2, 3, and it pushes in, and you get a drop of blood. That drop of blood is not going to be enough. So what I need to do is I need to force the blood out. So option number 1 is I give little pushes, or option number 2 is you milk the finger a little bit. Milking it is going to rub it from the bottom of the finger all the way out, and it'll force the blood out. As soon as I have a nice pile of blood there, that should be enough. I'm going to push the little test strip inside. Once that is the case, the machine will automatically turn on. It'll give me a couple seconds to turn on. 1, 2, 3, and it waits for my blood. Now, as soon as I'm ready to do that, don't put it into, but scoop it. So it's a little bit of a scooping mechanism. It'll sense whether there's enough blood. Take about 4 to 5 seconds, and it'll give you a reading. Before you even look at that, you want to protect your patient, of course. Of course, you're wearing gloves, and you're going to grab that alcohol swab that you used before, wipe off the blood, and hold pressure on it. Usually about 10 to 15 seconds of pressure. And use your patient. Tell them, squeeze tight. While you're doing that, you can look at your glucometer, and it says 114, so I know that's within normal limits. Normal blood sugar is anywhere between 80 and 120, and again, that's normal. Some patients may have 70, some patients may have 180. Especially if they had a meal recently, it might be a little bit higher. So 114 is considered normal, so I'm happy to report that I have normal blood sugar levels. But anything below 60 is what we consider dangerously low, or anything above 200 or 300 would be considered dangerously low. Every patient may have different limits, so ask the patients, what is your normal blood sugar? Especially if they're diabetic, they may know a little bit more about that. After I have that, remember, you still have some blood on there, so make sure that you don't contaminate yourself or anybody else. After about 15 seconds of holding that, I'm holding it for maybe 20 seconds now, the blood is going to dry. It's a really small hole that we use here. I don't particularly have to worry about bleeding, and I'm no longer bleeding about that. Grab that alcohol, and I usually use that to grab the little test strip off. Take the lancet, take the alcohol, and I usually just wrap it in my glove at this point. So take off the glove. Sometimes you contaminate the glove a little bit, and make sure you dispose of that properly. Don't leave that lying around. And that's pretty much it. You're going to take that, put it back in your kit. Make sure you take the test strips and put it back in your kit as well. You do not want to leave that lying around. We expect at the end of the tour, you come back with it's all completed. Maybe a couple of test strips or lancets missing from when you used it if necessary. But make sure that you bring along all the kits with you, and that is going to be your responsibility. So these are going to be in the AEDs and ready to use hopefully by the end of the month. Be prepared and be ready to start using them. I do want you guys looking up the protocol so that you can get familiar with it and be ready to treat the patients and really be able to assess them with the glucometer. Any questions, let me know.